Hello, everyone. My name is Dr. Luke Deckard with Back 9 PT and Performance. What I want to spend a little time talking about today is the body swing connection for elbow injuries. What we'll see is injuries to the lead and the trail side that are connected to potential physical limitations that you may have in your golf swing and also poor swing mechanics. So, we're going to dive into what elbow pain may be coming from today. So, this is one of the top 5 most common injuries in the golf swings for amateurs. And it's actually about number 2 behind low back pain when it comes to just your typical amateur golfer. And it's generally two conditions that you've heard about: tennis elbow and golf elbow. Yes, you can actually get tennis elbow from playing golf, and it's actually more common than getting golfer's elbow, which is always ironic. So for the amateur golfer, what I typically will see is they may get tennis elbow in their lead arm if they're a right-handed golfer, so my left elbow, and golfer's elbow or medial epicondylitis on the trail side. So a couple of reasons this could be happening is right off the bat, it could be due to in our swing at the top, we're casting. So casting is one of the huge mechanics that can cause pain into the elbow. The others kind of come away from this. Also, it can be scooping, so getting at the bottom, kind of getting flippy. You'll see here, I can even feel the stress on my elbows here on my right side and my left arm. And then kind of with scooping comes that chicken wing, right? So if we cast, scoop, and chicken wing, we're gonna have a really good chance of having elbow pain. And generally, like we said, that'd be tennis elbow or lateral epicondylitis to the lead arm, because in the swing, usually it's helping plane, and it's actually the wrist is going to be, if anything, inflection. But when we start getting casting or all this stuff, it comes into extension, which puts extra stress on that like lateral epicondyle bundle, or those muscles insert into that bone. And then, and then what happens here is that same bundle on the inside of the arm, the medial side on the trail elbow, gets stressed because instead of like holding off into an extension here, we're getting into flexion. So you'll feel it on the inside of that trail elbow. So if you're having either one of those, we need to be looking at the swing and make sure those aren't going on. And if they are, we need to see why. Because there's obviously probably some physical limitations and or just poor swing thoughts that are happening. The other thing that could be happening is you're coming over the top. That's another one that will tend to cause some of that elbow pain. So now that we know a little bit about what's causing that, and honestly, this time of year, hitting on mats is another big one. So if you're spending a lot of times indoors or hitting off mats at the club, you may want to, and you're starting to have some elbow pain, may want to start monitoring the amount of time you're spending practicing, just because that can have a direct correlation to elbow pain. So looking at that kind of in the swing, now we're going to talk about some parts of the body that could actually be affecting this. So one thing that's weird enough and that may not even seem as intuitive is that actual like poor use of the lower body can be one of the main reasons of any of those swing characteristics I just mentioned. So casting, scooping, going over the top, all of that could be poor lower body mechanics in the swing. So if you're not, initiating with the lower body and going, but we're getting here, like we said, coming over the top, starting to cast, those can be from the lower body. Specifically, if you have limitations in your hip mobility for extension and rotation. So that's something we need to check and make sure is not limited. And honestly, in most of my amateur golfers, it is limited. So especially just the everyday weekend golfer, I'll see that as a huge one. So we need to be addressing that because that could actually be causing your elbow pain, right? Hips, elbow, I know that seems crazy, but it's all the mechanics of it. The second one is directly related to that, and it is shoulder external rotation mobility. So external rotation in the swing is here. So what I want it to be able to do is get past that spine angle, especially in your trail arm. So if you can't get there, what a lot of times people will do is come over the top. So again, in the swing, if I'm coming up here, if I'm lacking here, that arm's going to get out. Maybe I'll come over or I'll get flippy. We're going to have issues. So having trail arm external rotation is going to be super important to make sure you're not going to have any of these limitations, and could be a direct cause to the elbow pain as well. And that limitation could be from the joint itself being stiff or the capsule being tight. But a lot of times what actually I'll see is it's okay in this posture, but in golf posture, and then we're stuck at neutral or worse. And what that tells me as a physical therapist is that your actual limitations are in the stability component. And we need to be trying to address, strength to those external rotators in the 90-90 position, not just living down here and doing things. That needs to be part of your program outside of just a general elbow rehab where you're doing, dumbbells up and down or doing the hammer. Those are okay, but we need to address the root cause of what's going on. So the big takeaways we have, right, is that if you have any of these swing characteristics going on, those are likely part of the cause of your elbow pain. And secondly, if you have limitations in your hip range of motion for rotation or extension, if we have just poor use of the lower body, if we have poor external rotation mobility and poor external rotation strength, those are going to be likely huge causes for your elbow pain as well, and something that we'll want to make sure we're addressing with your fitness or rehab programs. So give yourself a chance of checking those out, or schedule a call with us at Back 9 PT and Performance, and we can go over all of that and get you set up for an assessment. All right, take care.